Welcome back. Multiple sclerosis is a disease with unpredictable symptoms, sometimes with the most severe cases causing paralysis, chronic pain, vision loss, and so much more. Joining us today is Dr. Ashraf Hanna, Director of Pain Management at the Florida Spine Institute, along with his patient, Joellen Traern, an Air Force veteran that found relief for her MS through the use of IV ketamine treatment. Thank you guys both for being here today.
Sure,
Thank you.
So tell me a little bit about your personal story with MS.
Well, it all began while I was in the Air Force. I started having neurological issues, widespread pain, vision issues, foot drop syndrome. And after I saw many specialists, doctors, neurologists, I was diagnosed with multiple sclerosis through a spinal tap test.
Okay. Now, when did you go see Dr. Hanna?
I began seeing Dr. Hanna for my neck and back. But as the pain became really widespread, hitting a 10 out of 10, and my other neurological problems were not being kept in check by the conventional MS drugs, Dr. Hanna suggested to me to try IV ketamine therapy.
Right. And what were your results? Was it something like, oh, this is finally something that works?
It was 100% better. It's like you flipped on a light switch, and
wow.
My foot drop syndrome, the weakness was gone. My cognitive thinking was back. I have a chance at life again.
You have a normal life again. That's what we hear so much with people with chronic pain, that it seems like after a while your life kind of revolves around dealing with this chronic pain.
Absolutely.
Good days and bad days, and that defines your life. Now for you, Dr. Hanna, MS, this is something that's new, like some of these symptoms can be treated with IV ketamine.
Well, I would like to emphasize, I'm not a neurologist.
Right.
And I do not diagnose or treat MS with IV ketamine as a first line of therapy.
Okay.
Actually, most MS patients, their symptoms are adequately controlled with conventional MS medications. So we only reserve IV ketamine for those cases that are failure to conservative care or their conditions is progressively deteriorated.
So where did the idea come to you? Because we've seen this, you're talking about fibromyalgia, and we've talked about depression, and we've talked about Lyme disease, and all these different things that IV ketamine has been able to help certain patients that have chronic pain as a result of some of these. Where did the idea of maybe tackling something like the pain that comes from MS come from?
Well, it actually began after I had a great and successful treatment using the IV ketamine for an autoimmune skin condition called lichen sclerosis. And the big surprise came that not only the pain got significantly better, but the actual size of the skin lesions got a lot smaller. So that actually prompted me to think that I can probably use the IV ketamine for other autoimmune conditions like MS, for example.
Wow. And how quickly were you able to see results?
As soon as I came out of ketamine,
goodness.
it was instant.
It was instant.
I mean, I still have some of the symptoms, but they're bare minimal.
Life-changing.
It was life-changing. Ketamine was a last-ditch effort, and then I was going to be hospitalized, institutionalized, because I could not function. But everything was a turnaround.
So much different. And you hear so many of we've heard so many of these great success stories, people coming in here and saying, especially with Lyme disease and fibromyalgia, and you hear about the chronic pain with so many of those, and the pain just kind of takes over. It's got to be good to see results like this, to see these patients that are, are so close to going to the hospital.
Absolutely.
Now, what is next? What's the next thing that you're working on with IV ketamine?
Well, I believe IV ketamine is a very strong anti-inflammatory for the brain, if not even the most potent drug, as anti-inflammatory for the brain. And I believe it has a lot of potential for other neurodegenerative diseases like Parkinson's disease, ALS, and other diseases like myopathies. And I think you're going to see and hear very soon some amazing results. We have some myopathy patients that were on wheelchairs and were said or were told that this is a terminal conditions, and now they're actually walking.
All right, some wonderful information as always. Thank you, Dr. Hanna, for being with us, and thank you, Joellen. Best of luck to you. Now, if you are interested in talking with Dr. Hanna to get more information, you can call the number right there on your screen for an appointment, or you can go online to the website right there. We have that online for you as well. We'll be back with more Studio 10 Live right after this next.